And tonight we're going to talk a bit about the relationship between autoimmune disorders and autism spectrum disorder. And maybe hold your questions until we're done with the slides. Maybe you can send them via the chat if you're tech savvy. And why don't we go to the next slide? So we don't know what causes autism, right? It's a very heterogeneous syndrome, ranging from people that are minimally to nonverbal to people that are highly verbal, from profound autism with significant cognitive impairment to above average intelligence. So we have a wide range of people to try to care for and to try to determine what might cause autism. So one of the things that the Lurie Center has chosen to pursue as a potential, biological mechanism underlying autism is immune function. And we know that about 10 or 15% of people with autism have a identifiable genetic cause of autism. That means 85% have an unknown cause, which we think may have environmental contributions. And immune function we think of as sort of a interaction between genetics and environmental causes. So next slide. So the first paper ever published in the medical literature appeared in 1943, and it was published in a journal called Nervous Child. And the author was this man, Leo Kanner, spelled Kanner, but it's pronounced Connor. He was from Austria. He was a child psychiatrist. He was at Johns Hopkins. And he saw these children who he thought had something in common. So he wrote a paper describing each of the 11 children in quite a bit of detail. If you don't have this paper, if you've never read it, I'd encourage you to track it down, because it's really the classic and still probably the best description of autism in the medical literature. And I go back and read it every year or so because I continue to learn things from it. And the title of the paper was Autistic Disturbances of Affective Contact. So that's still kind of what autism is. I don't know, Anne, if the slides disappeared or...
Thank you.
Okay, we can go to the next slide. So you'll learn a lot from this paper, but one thing that got my attention probably after we started looking at immune function in autism, when I went back and read the paper, there were all of these descriptions of things that the 11 kids had that in one way or another might be related to immune function. So that kind of got me excited that, wow, even way back with the first description, there may have been observations that point to immune dysregulation in ASD. So I'm going to show you some of these statements that he made. So following smallpox vaccination at 12 months of age, the patient had an attack of diarrhea and fever, from which he recovered in less than a week. We certainly see kids with autism who have had some kind of physical reaction to vaccinations when they were younger, right? Whether they had a rash or had a fever or a seizure. Most people didn't have any kind of reaction, but some had abnormal reactions to immunizations, and you can see those in people who are neurotypical as well as people that have ASD. This fellow, he vomited a great deal during the first year, and feeding formulas were changed frequently. So when we take a history of early life in people with autism, it's not uncommon to hear about their difficulty tolerating various types of formula, including, breast milk, formula, whether they have an allergy to milk products, etc. So it's not uncommon to hear about that. People with failure to thrive, difficulty gaining weight, and oftentimes they end up on, a special type of formula where the food is broken down into tiny elements that they can digest. And here's another girl. She was tube fed 5 times daily up to a year. So again, having difficulty tolerating formula, some kind of allergic reaction. Next slide. Here's another one of the kids. He had been kept in bed often because of colds, bronchitis, chickenpox, strep infection, impetigo, and a vaguely described condition which the mother insisted was rheumatic fever. So again, lots of sort of vulnerability to infection, which might imply there was something going on in the immune system. Rheumatic fever might be related to an autoimmune phenomenon. We see lots of kids with autism who had a history of recurrent infection. It's not uncommon to hear a lot about kids that had recurrent ear infections when they were children, sometimes resulting in the need for ear tubes, sometimes resulting in the need for multiple sets of ear tubes. That's pretty common in kids with autism. Hypothyroidism, which can be caused by an autoimmune process that led to the need to give thyroid hormone. Autoimmune hypothyroidism and hyperthyroidism are autoimmune disorders that can be seen in individuals with autism and certainly in their family members, not uncommonly. And then again, frequent hospitalizations due to feeding problems. Next slide. This child suffered repeated colds and ear infections requiring ear tubes. For 18 months, this girl was given pituitary hormone and thyroid hormone. So again, implicating underlying autoimmune problems. Next slide. So let's go here first. So this was really the first paper published I'm aware of in 1971. And it was published in a journal called the Journal of Autism and Childhood Schizophrenia, which is now called the Journal of Autism and Developmental Disorders. Back in the early times, it wasn't clear what autism was. Many people thought it might represent childhood schizophrenia. Because these kids presented with kind of unusual symptoms and behaviors, and if somebody can't talk, it's impossible to determine if they're psychotic or not. You can't tell by asking them because they can't tell you. So people wondered if this kids with autism might have some form of early onset schizophrenia. Now we know that that's not the case. The large majority of people with autism never have psychotic symptoms, although they're vulnerable to the onset of schizophrenia, as vulnerable as you or I. They're not protected against it. But anyway, this was the first description of a child with autism with a significant amount of autoimmune disorders in family members. So here you see the first child had no symptoms. The second child, and these are all boys, had hypothyroid, parathyroidism, Addison's disease, which is, I think that's what John F. Kennedy had, right? So he had an autoimmune disorder. Monoliasis, that's yeast infections, right? So again, suggesting an immune vulnerability. Alopecia totalis, so that's a autoimmune disorder where you lose all of your hair. I've certainly got a couple patients with autism who had that. The third son has hypoparathyroidism, Addison's, yeast infection, but also type 1 diabetes, which is an autoimmune disorder. So you can see over time, it seems like there's sort of a increase in the load of autoimmune problems. And then the fourth son has autism and some comorbid autoimmune disorders. So this is what, 50 years ago. So I thought it was a important observation by these clinician researchers, and they hypothesized that there might be antibodies in this situation that affect the developing brain. So, to me, it's not hard to imagine that, let's say a mother is, here's a woman, she's pregnant, she has an autoimmune disorder, and, pregnancy is stressful. Half of the baby is the mother, right? But the other half of the baby is the father genetically. But we know that autoimmune disorders are disorders where your body attacks itself. Well, half of the baby is yourself. And let's say the stress or an infection in the mother, some kind of stressor triggered the worsening of her autoimmune disorder, and these antibodies are being released and they're attacking her body, but they may also be crossing the placenta and affecting the development of the fetus's brain. So that's sort of a hypothetical potential mechanism underlying a subtype of autism. Next slide. So we became interested in this possibility, I'd say 25 years ago. So we've had an interest in this for quite a long time. And if you see the second paper listed here, Sweeten et al. Sweeten was a student that came to me when I was at Indiana, and he had this idea that maybe autoimmune disorders might be related to autism. I hadn't really thought about it much until he brought it to my attention. That's the value of young people, is they bring things to you that you hadn't considered yet. So we did a study back then where we just took 100 kids with autism and let's call it 100 normal controls. Now, these were children with autism. And then we gave the parents a survey and said, hey, tell us if you guys have any autoimmune disorders, or if you know of any in the first and second degree relatives of the child. And we did the same thing with the normal kids. And what we found is that there was a higher rate of autoimmune disorders in the first and second degree relatives of kids with autism compared to the first and second degree relatives of the normal kids. And here we listed some of the autoimmune disorders we ran into, hypothyroidism, rheumatic fever, and various things, which was, again, an important result. It was published in a journal called Pediatrics, which is a very high-end, top-rank journal. So for them to publish what I think was and we did, it was a relatively poorly designed study, tells you that they were interested in the report. Now, what we've learned over time is ways to improve upon that study. If I handed you guys as mothers or fathers this piece of paper and said, tell us which other relatives of your child might have them, well, you're not going to really know for sure, right? I mean, you might ask Aunt Betty if she has rheumatoid arthritis, and she says yes. Well, she may actually have osteoarthritis, right? We don't know for sure. And there are going to be a number of relatives that don't know they have autoimmune disorders, but they do. Things like that. So the only way to really know if relatives have autoimmune disorders is to ask each of them individually. If they think they do, then we'd want to verify that in their medical record, right? And if they don't think they have one, but they tell us they have a lot of symptoms of autoimmune disorders, then we want to bring them in and examine them and determine if they have autoimmune disorder. So, and the other thing we know is that autoimmune disorders often begin later in life when you're in your 20s or 30s or 40s. So if you're asking first and second degree relatives of kids with autism who are 4 or 5 years old, many of the relatives wouldn't have passed through the age of onset of autoimmune disorders yet. So the rate is going to be lower. So learning all of those things in a little bit here, I'm going to tell you about the study we designed that we think is the right way to do it. But what you also see here is that after our study, a lot of other groups did the same study to find, and they found that autoimmune disorders certainly seem to be higher in the relatives of people with autism compared to the relatives of normal kids. So that's pretty impressive, right? Pretty striking. Next slide. So how long have I been doing this? 35 years. I've seen a lot of new evaluations of people with possible autism in 35 years, right? Let's say I do 3 a week. What's 3 times 50? 150 times 35 years. I've evaluated a lot of people with autism and talked to their parents. And when I take a family history like everybody else does, we'd ask about things like, do you know of anybody in the family with autism or depression or anxiety? But a number of years ago, I started asking about autoimmune disorders when I took a family history. Nobody else does that. Why would you? Right? Why would you? But I guess I began having mothers tell me that, oh, well, I have MS. So I got this idea that maybe I should ask about it. And these are the 8 autoimmune disorders I ask about every single time. I did a new evaluation today on a 33-year-old woman from the state of Iowa, right? And I asked this a question, to the mother, anybody in the family that you know of, relatives that have these disorders? So it's common for me to do this, but as I've done it, I've become more convinced that autoimmune disorders are more common in relatives of people with autism than normal people. So I've never become less enthusiastic about pursuing this. Next slide. So we decided to design the ideal study, right? And do it right, finally, 25 years later, before I get too old to do it. And I'm pretty close to that now. I'm almost too old to do it. So we're doing a study where we take 100 adults with autistic disorder between the ages of 18 and 50, right? That way we know their relatives have passed through the age of onset, many of them, for autoimmune disorders. And these people with ASD, they have to meet criteria for autistic disorder, not Asperger's disorder, not PDD-NOS, what I call classic autism, because I think the likelihood of having family members with autoimmune disorders is more likely in the people with more classic, severe autism than in sort of higher functioning people, where the dose of whatever's going on may be less intense. And then we're going to find 100 matched normal controls of the same age. And we're using, these are all going to be males. I know that autism can affect females, and I don't mean to exclude them, but we want to have a relatively homogeneous group before we expand out to females or studying individuals with autism who are more verbal and have a higher IQ. We want to sort of go after a clearly defined sample first. And, you know, we're going to characterize these people with autism so we know they really have autism, even though we already do know they have it, because we have to do these other tests to prove, you know, when you describe the results in the literature, you have to convince people that you did it the right way. So we're going to do these formal diagnostic tests, right, of ADIR and ADOS. We're doing IQ testing. We're characterizing their verbal ability, that kind of thing. So they're going to be well characterized. We're going to know they have DSM-4 autistic disorder for sure. We're also going to make sure that the normal controls don't have autism and that their relatives don't have autism, and that they have at least, you know, they have a normal IQ range. But then you say, okay, here you have this person with autism who meets criteria for your study, and now we're going to try to determine if their first and second degree relatives have an autoimmune disorder. How are you going to do that? Well, we're going to interview them in real time, right? And we're going to say, hey, do you think you have any autoimmune disorder? Tell us if you do or not. And if they say, sure, I think I have diabetes and I think I have rheumatoid arthritis, we're going to say, well, do we have permission to actually look at your medical record? Because we want to confirm it, right? They may think they have one and they don't know it, or they don't know they have one that the doctors think they have in their medical record. So we're really going to be thorough in determining if they have an autoimmune disorder that's been confirmed in their medical record. But we're also going to ask each of them a bunch of questions about symptoms, right? Symptoms that could be part of a bunch of autoimmune disorders. And they're like, well, sure, I have fatigue and I have, my eyes feel like they're bulging out or they're dry, all these symptoms. And if they check enough symptoms, but they say, I don't have any autoimmune disorders, but we think they might because of the symptoms, we're going to bring them in and really work them up. So we're going to do a thorough look to determine clearly autoimmune disorders in first and second degree relatives. Now, you might think, well, if a person with autism has a lot of family members with autoimmune disorders, I wonder if they're going to inherit that vulnerability. Nobody's really looked at people with autism themselves yet to see if they have autoimmune disorders. Well, that seems like a no-brainer, but it's never been done. So we're also going to evaluate the adults with autistic disorder to see if they have autoimmune disorders. Because if you're, if a third of people with autism eventually develop autoimmune disorders when they get old enough to have them, that'd be pretty important to tell the world. Because if you're their doctor, you're going to want to know if they have the possibility of developing autoimmune disorders later in life so you can diagnose it and treat it. Now, other than sort of questionnaires and physical exams, we're going to draw some blood on these patients. to look for a couple markers of autoimmune disorders and inflammation, right? Autoimmune disorders are going to cause inflammation in the body. One is called the ANA, the anti-nuclear antibody. If you have an autoimmune disorder of any type, this is likely to be abnormal. So we want to know if the patients have an abnormal ANA and if the parents do. The other one we're going to look at is called C-reactive protein. This is a blood marker that goes up if you have various types of causes of inflammation. So they're simple tests, but they'll tell us a lot, okay? And what else should I be saying right now? Maybe not a lot more. This is the email address, Lurie Center Research at mgh.org. If you have any interest in your adult child, male child, participating in this study, you could email them and say, I'd like to learn more about it, or you could call them and leave a message. Not everybody's going to qualify for the study, right? But if you think you're interested, we could determine that. Now, if you have, well, I'll leave it at that. If you're not 18 to 50, your child, then don't do it. If it's not a male, then don't do it because we're not looking at those people now. But otherwise, express some interest if you have it. Next slide. Okay. That just reminds me to tell you the two most important things about the Lurie Center that make us different from everybody else. Number one, we treat people from birth to death. Well, what's death mean? Well, that means 100 years old or older, because all of your kids are going to live till they're at least 100. And we want to take care of them until that point in time. Most people that take care of people with autism, they say we're done with that at the age of 22, right? We don't see adults. Well, we're going to do it for another 80 years. And because we think treating somebody throughout their lifespan is important. We know that when you're 22, you're going to still have issues, right? You're going to, in fact, have more issues because you're going to develop medical problems that kids don't have. You're going to develop psychiatric problems that don't present until early or mid-adulthood. It's harder work, but we're going to do it anyway. The other thing is that we're multidisciplinary. We have every kind of doctor that you need to take care of people with autism, whether that's child and adult psychiatry, child and adult neurology, primary care, GI, medical genetics, speech, OT, PT, neuropsych testing, anything we can think of that might help somebody with autism, we try to add that to our people. That way you guys aren't running around to 10 different doctors. You come to one place for all of your care, and we actually talk to each other so we can do comprehensive multidisciplinary care. The other thing that we're launching at the Lurie Center, the first transition that everybody worried about was when your kids turned 22. We called that a transition. Well, guess what? There's another transition. Guess when it begins? 30, 40, and 50. And what are you transitioning into? Becoming elderly. So we're launching a program called Aging Well with Autism, where we're going to develop the ability to take care of people with autism as they become elderly or geriatric. Because you can imagine all of the different kinds of things we're going to need to think about in order to do that. There's no textbook written on that, but where we can look up how to do it, right? So we're going to have to figure that out with you guys. We're going to want to know what the things you're worried about for your children when they become 40, 50, 60, 70, 80, 90, and 100.